All right, so you've probably heard the news about a measles outbreak in Shasta County, and there are a lot of questions flying around. In this explainer, we're going to cut right through the noise and give you the essential facts straight from the health officials. Let's just dive right in. So, the first question on pretty much everyone's mind is, how big is this really? What's the scale of this thing? The official number of confirmed cases is 8. Now, that number might sound small, but for something as incredibly contagious as measles, the story behind that number is what really matters. And here it is, the single most important piece of information right up front. Health officials are saying this outbreak is contained. That's huge. It means we're not seeing it spread uncontrollably through the community, and that's all thanks to some really smart, fast public health work that we're about to get into. So let's dig into that. How exactly did they get this contained, and what does that mean for everybody in the community right now? What's really telling is this quote right here from Public Health Director Katie Cassidy. She's giving a direct shout out to the community for their quick action and support. It's just a perfect reminder that in a situation like this, public cooperation is absolutely crucial. So, to really understand how this was contained so effectively, you've got to look at the timeline. Let's walk through how this whole thing played out step by step. Okay, so it all started back in late January when the first patient was out in public. A week later, on the 30th, that first case was officially identified. Then, fast forward to February 10th, and boom, 7 more cases are announced. But the very next day, officials confirmed that even with those new cases, the outbreak was still contained. And this is the secret sauce right here. This is why it worked. Those 7 new cases weren't a surprise. Health officials already knew about them. They had been identified through contact tracing and were already isolating before they could spread it to anyone else. I mean, this is a textbook example of public health doing its job perfectly. All right, now for the information I know a lot of you have been looking for. Where exactly could people have been exposed from that very first patients? So here's the list of the specific spots with the dates and times, all from late January. You can see it's a mix of places around Reading, a park, a restaurant, a gym, even Costco. Go ahead and take a good look at this list. And let me be absolutely crystal clear on this next point. The window for potential exposure at these places is long gone. Health officials have confirmed there is 0 ongoing risk. These locations are completely safe to visit now. Real quick, before we jump into what you can do to stay safe, we just want to credit where we got the information for this explainer. All the information we're sharing with you today comes from the excellent local reporting by the team at Shasta Unfiltered. Their work is just so vital for keeping everyone in the loop. Okay, let's switch gears and talk about the really practical stuff, what you need to look out for and how you can protect yourself and your family. So take a look at this photo from the CDC. This is the very distinct measles rash we're always talking about. You can see how it's made of these flat red spots. It usually pops up on the face first and then spreads down the body, typically about 1 to 2 weeks after someone's been exposed. But here's the thing. Before you ever see that rash, other symptoms usually show up first. We're talking a really high fever, a nasty cough, a runny nose, and red, watery eyes. Those are the early warning signs you've got to be on the lookout for. So what's the best possible defense against a virus this contagious? Well, the MMR vaccine. And the numbers speak for themselves. 2 doses give you about 97% protection. That is just an incredibly effective tool. Okay, let's put this all together into a few simple, actionable steps. First, know your vaccination status. Second, if you think there's any chance you are at one of those exposure sites, keep a close eye out for the symptoms we just talked about. And third, and this is so important, if you do start to feel sick, please call your doctor or clinic first. Don't just walk in. Calling ahead is the best way to keep it from spreading to others in a waiting room. So as we wrap this up, it's kind of interesting to step back and look at the big picture. Because while any outbreak is serious, the story here in Shasta County is, well, it's really a success story. It's a real-world example of how things like contact tracing, isolation, and a community working together can stop a dangerous virus in its tracks. It really makes you appreciate the systems we have in place to keep us all safe.